Is your vagina burning, itching, or just downright painful? But you've been told by people that this is just part of the normal aging process and to basically deal with it. Well, if you've ever been told that, this episode is for you. I'm Dr. Mary Mina. Welcome to my channel, The Skin Real, where I give real people real information so that they can make informed decisions about their skin health. Sound good? Let's get into it. Now, this is my weekly recap episode where I break down my key takeaways from my most recent interview. This week, my guest was Dr. Diana Londoño, and we were discussing all the skin changes that can happen with our external genitalia that occurs during perimenopause and menopause. And I get it, this conversation can feel a little awkward, it can feel a little taboo, but it's so important that we give women information so that they can choose how they want to age and they can choose what they are going to put up with, what they're not going to put up with. They need to know the risk and benefits. So that's why on this week's episode, we went below the belt, pun intended. If you want to hear the full episode, be sure to check it out after this short one. So, yes, on this week's episode, I was talking about something that is a little taboo. In fact, I think on some social media platforms, you're not even allowed to say vagina or vulva, which are medical terms for a woman's body, which is so ridiculous, but that's a conversation for another time. But you may be listening or watching thinking, what is your vulva? I think most people have heard about your vagina, but truly your vagina is just the birth canal that a baby comes out of or in penetration, but your vulva is the external skin down there, if you will. And a lot of people, A, don't know it's called that. And secondly, they have no idea what's going on down there. They don't know what it looks like. They don't know where the urethra is, which is where you urinate, or the clitoris, or the vaginal opening. You may not know that you actually have two lips that compose the vulva, your labia majora and then the labia minora. And so these topics are really foreign to a lot of people and not something that a lot of women feel comfortable talking about. I mean, honestly, even on this podcast, I'm kind of like, wow, I've never said these words to my audience before. I've never spoken like this. It can feel weird, but it's important we talk about what's going on. So if you're 40 and probably the closer you get to 50, you are going to start to notice some changes. If you aren't noticing some changes in your vulvar skin, consider yourself lucky. But you may not even know that these changes are happening initially. You may just sort of be dealing with them. Like when I had my bunions, I didn't realize they were hurting my feet. I just got so used to it. And then when they were removed, and I could wear shoes and they didn't hurt, I was just blown away. So, as we approach menopause, which the average age is about 51 in the US, but these symptoms can start even 10 years before. Your skin, just like your facial skin, you maybe have noticed in your 40s, is starting to get a little crepey. It's not as plump. It's starting to maybe look like it's shriveling or falling. You don't have as much collagen. It's not bouncing back as much. You have more wrinkles. This is all happening with your vulvar skin as well. And your labia minora, which are the inner lips of the vulva, are actually shrinking or what we call atrophying. They're disappearing, which is kind of crazy. But this is important because this skin protects your urethral opening, which is where you urinate, where you pee. And when you no longer have that protective barrier, this is why so many women, especially as they get older, struggle with recurrent urinary tract infections or UTIs. And if you've ever had one, you know they suck. They're painful, they're uncomfortable. You feel like you have to go to the bathroom all the time. You can't sit still. But beyond that, they also can be life threatening. I remember as a resident taking care of patients in the hospital, patients would have sepsis, which is a very concerning and organ failure because of a UTI that got into the bloodstream. So this is not insignificant. And it's really crazy that we don't talk about this more. But that vulvar skin, that vaginal lining, it is starting to dry out. It is no longer as plump. It's no longer as elastic. And this can cause the skin to crack, to shrivel up. It can cause itching. and burning. And if you're urinating and you have cracks in the skin, it's really going to be painful. And it's going to be painful with intercourse. All these symptoms are happening because of your estrogen levels dropping and depleting. And once you hit menopause and you are postmenopausal, your estrogen levels are zero unless you take hormone replacement therapy. So think of your vulvar skin like the skin of your face, right? We talk all the time about your skin barrier and not to overly dry it out and to have a healthy microbiome on the skin and not to do things that are irritating, right? This is all important for the vulvar skin as well. And we need to help it out and assist it during this period of life when our estrogen levels are dropping. Now, I know a lot of women have sort of accepted these symptoms as just normal, a normal part of aging, but you don't have to suffer in silence. And even if you do know that these are unpleasant symptoms, you might be too embarrassed to talk to your doctor about it. But I would encourage you to know you do not have to suffer in silence. And we actually have an incredibly safe treatment for your vulvar skin, and that is topical estrogen. Now, a lot of my patients, I have been prescribing topical estrogen for their face, but you can actually use topical estrogen for the vulvar skin. And in fact, it is so, so important. I really recommend you talk about this with your doctor. Now, a big objection Dr. Londoño hears from her patients is that, well, I'm not sexually active. I don't need to worry about that. I don't need to worry about painful intercourse. But here's the thing, it's not just helping with that. It's helping prevent the skin breakdown. It's helping prevent urinary tract infections, which can be very severe and life-threatening. It is helping you feel more comfortable sitting. It's helping with increased urination and leakage and those symptoms. So even if you're not sexually active, there most likely is a role for topical estrogen in your life. Now, here's the thing. If you get a prescription for topical estrogen at the time of this recording in 2025, there is a black box warning on your estrogen cream. And if you read that, you're going to get really nervous and scared. You're going to think your doctor's trying to kill you. Why did they prescribe this horrible medication for you? But here's the thing. The labeling on the box is outdated. It is flat out false. It has been disputed, and it's based off of a study nearly 30 years ago, and it was sort of extrapolated from that. But here's the truth: as topical estrogen in the vulvar skin can be used incredibly safely. It is something you have to do, just like eating right and exercising. You have to keep up with it. It's not something you do once and you never have to do again. So, this is sort of a topical therapy you would do daily, just like you put on your moisturizer on your skin, right? And by doing this, you can help rebuild the tissue, restore the microbiome, reduce UTIs, sex can be more enjoyable, and you can have comfort again. And this is all due to a topical cream. The best news is that there is no systemic absorption with this. So, people who have breast cancer, people who don't want systemic therapies, they are still candidates for vaginal estrogen. So, don't be scared by the black box warning. In fact, just this month, some of my physician colleagues were advocating and testifying in front of the FDA to get this label removed because it is hindering women getting the care and the treatment that they deserve because it's putting this fear into their minds when it shouldn't be there and it's false information. Topical estrogen should be very inexpensive. If you go to Coughs Plus Drugs, which is Mark Cuban's pharmacy, it should be definitely under $100, probably around the $40 to $50 range. So cost is hopefully not an obstacle for most people to get this medication. And it truly can be life saving. If your doctor isn't mentioning it, advocate for yourself or find someone who is menopause trained or certified or at least knowledgeable who can help you get the treatment you really deserve. If you've been listening to the podcast, you may have heard a podcast a couple weeks ago with Dr. Kira Barr, who's a psychodermatologist, talking about the importance of the mind-body connection. And I love that Dr. Londoño, who is a urologist, which urologists are surgeons, Surgeons, typically, the characteristic is they always just want to cut, right? They want to cut, cut, cut. They don't want to talk to patients. So I love that Dr. Londoño considers herself a psychourologist. Now, what the heck does that mean? Well, that means that she likes to help patients make the connection between their mind and their body and whatever symptoms they're experiencing or feeling. And it's not to say that it's all in your head, that the symptoms aren't real, but it's clicking and putting the puzzles together that if you feel this way, then your symptoms get worse. How can we perhaps reframe something? It's getting curious about your symptoms, being aware of them, and also being aware of your thoughts and how that makes you feel. Because all of this comes together. This is not just woo woo, but this is really taking care of the body holistically because we cannot just piecemeal the organs. Like, I'm just a urologist. I only focus on this. Go see a psychiatrist for this or a neurologist for this, right? Which is classically how things have been. But it's important to know that all of this is connected. And certainly during the period of perimenopause and menopause for women, there is so much mind drama, social shame, stigma, all these things that we are dealing with as our bodies feel like they're on this wild roller coaster of perimenopause and then menopause. And so it's super critical to realize the importance of our mind with any of our medical conditions that we're struggling with. And the first step is really just being aware. And I know as a dermatologist that stress can show up on our skin. And Dr. Londoño was sharing how the same thing is true with urology, right? That grief, anxiety, relationship changes, these are not just emotional feelings that we have. They can manifest physically. Maybe it's a constant urge to go to the bathroom. Maybe it's pain with sex because of a traumatic experience. And our vulva as women, it's deeply tied to our identity, our confidence, and of course, intimacy. And it's not a part of our body that we feel really comfortable talking about or sharing our feelings about. And so I think a lot of women suffer in silence. They feel shame about how they're feeling or their symptoms. And so it's important that we really break those walls down and those barriers to getting care. Just like with skin health, taking care of your body from within, including your mind, but also things like sleep, hydration, journaling, movement, right? These are not just nice to haves. These are imperative during perimenopause and menopause for really just taking care of our bodies as a whole. Now, 50% of the population in the world is going to experience menopause, right? And I say aging is the gift of life, right? So we can't really complain about aging because the alternative is not necessarily what we want either, hopefully, right? So if we're lucky enough, we will get to go through menopause. We will get to age and live lives. But the important thing is we want to live healthy lives, right? We want a long health span, not just a long life. So it's important to note the changes that are happening, especially in the vulvar skin. They're real. There are medical reasons why this is happening. But the good news is there are things we can do to help, to be curious about what we're going through, and to have awareness. You don't have to suffer. There are things that can be done. And just like your facial skin, your vulvar skin deserves some attention too. So maybe after listening to this episode, you will feel inspired to get the help with any symptoms you're experiencing. And hey, if you've never heard what a vulva was before, then maybe you want to take a few minutes to familiarize yourself with your own, check it out, visually inspect it, and see what's going on for yourself. And if anyone makes you feel ashamed for talking about this or embarrassed, be sure to send them this episode. Now, if you want to hear the full episode with Dr. Londoño, you can check it out here. And I will see you next week, friend.